what about dealing with the fact that there are so many doctors out there today that call themselves cosmetic surgeons? It's more than ever than what I've seen.
Well, I mean, it's a multi-billion-dollar industry. And when you have something that creates such an income, or the potential income, you'll have a lot of people jumping on the bandwagon, everything from medical spas all the way up to physicians who are emergency room physicians or gynecologists. And the most important thing, a patient or a person who wants to achieve a cosmetic surgery result is training. You need to look at training. Years ago, cosmetic surgery wasn't as popular as it is today, and you could get away with a couple of people specializing in a certain area. They would do breasts, or this guy would do faces. But with cosmetic surgery becoming so big, there are a lot of training programs out there, and training programs meaning fellowships. After you completed a residency, you complete a fellowship in cosmetic surgery. There are many physicians who will take weekend courses because of the insurance industry. Reimbursements are down, office overhead is up.
Okay, so how does somebody who's looking to have something done, how do you figure out who's best qualified?
Well, the most important question you want to ask somebody is, where did you get your formal cosmetic surgery training? That should be the first question that someone asks a physician.
And what kind of answer are they looking for?
You want to look for somebody who's done a formal, accredited, didactic fellowship in just cosmetic surgery after their preliminary training in whether it be general surgery or orthopedics or ENT, plastic surgery. Even plastic surgeons, plastic surgery is mostly related to a reconstructive
scar revision,
right? And amputations, big tram flaps, removals of cancer, tissue deficits.
I think people think that the term cosmetic surgeon and plastic surgeon are interchangeable, but they're not.
No.
Two totally different things.
Right. Well, years ago, when cosmetic surgery wasn't big, you had some plastic surgeons who would kind of switch off and make their primary practice cosmetic surgery. But because it's become such a big field, there's a lot of innovation in the field that you really need to be trained in just specifically that one field, either cosmetic surgery. If you look at years ago, let's take emergency medicine, for instance. Most emergency rooms were staffed by doctors who were internal medicine, and they were moonlighting. But as the emergency room became more of an area, more of a modality for people to get medical care, it became such a specialized group of physicians that they actually started fellowships and residency programs that dealt directly with people who came to the ER, and they became ER or emergency room physicians or emergency medicine. So it became a whole specialty that kind of evolved out of what society was doing. And the same thing has happened because society has become so hip on looking good, feeling good, performing better. The whole cosmetic surgery realm has opened up and has expanded, and many innovations have come out of other specialties. And so what they've tried to do is contain that one specific specialty of cosmetic surgery. Years ago, you had somebody who did breast, and they did great breasts, but they didn't do faces or they didn't do noses. Well, now if you find someone who does a cosmetic surgery fellowship, they usually will do the gamut of cosmetic surgery, because that's 80% of their training is devoted to cosmetic surgery. 20% is